Welcome to East Lothian Community Hospital. We first moved in March 2018 for the outpatient department. The rest of the building was opened up in November 2019. We have been able to attract an awful lot of new services and businesses into the area, and we're continuing to do that and hope to expand it over the next 2 or 3 years. Originally, from an outpatient perspective, we had 30,000 outpatients on this site. That has now moved up to very nearly 50,000 outpatients per year. So there's something we're doing that is attracting patients and services onto the site. Residents can now access the following list of health services locally. Adult ear, nose and throat, abdominal aortic aneurysm, commonly called AAA, adult psychiatry, antenatal services, audiology, cardiology, dentistry, dermatology, diabetes, gastroenterology, gynecology, lymphedema, minor ops, various monitoring clinics, MSK, neurology, palliative care, phototherapy, ophthalmology, orthopedics, osteoporosis clinics, plastic surgery, podiatry, rheumatology and urology. During COVID, a lot of our clinics had to pause or in some cases close. Post-COVID, we're almost back to normal now and we're back up to what we'd be expecting to see on an everyday level. Whilst we were closed for COVID, we made really good use of new technology. Near Me was the name it was given, and that allowed consultants to speak to patients in their own homes over, of course, video conferencing type facilities. And the benefit to that was it enabled patients to continue their journey and not miss out on their clinics.
Having local services to the people of East Lothian is a massive thing. It means that people aren't having to travel into Edinburgh on the bus or train service. We have fantastic parking facilities now, so we have disabled areas. It's accessible for all because it's a fantastic new building.
Almost always, when a patient's being admitted to the department, we walk them from admissions down to the room that they're going to get changed into. And they'll always say, oh, this is nice, oh, how old is this building? You know, and they always ask questions about it, and they all notice just how fresh and light an area it is. It's fantastic.
So there's 1 or 2 new developments. We've really ramped up the amount of nurse-led clinics we have, and what they do is allow for a patient to come and get monitored routinely, and if there's anything that's shown up in that monitoring, we can then make an appointment with a consultant. So there's 4 services at the moment. There's gastroenterology, there's renal, there's diabetes, and there's rheumatology. We will be expanding that to include a couple of new ones in the future, one of them in lymphedema, the other one we're still in negotiations with the services. One of the other developments has been UV phototherapy, whereby people who would normally have had to go into Edinburgh, specifically the Lauriston building, can now get that treatment here. It's a course of between 10 and 15 weeks, and you come twice a week and go into a phototherapy booth. It's nurse-led service, it is really popular and saves patients having to travel into Lauriston. It's got to a stage where we're almost thinking of doubling our capacity by running it 5 days a week as opposed to 3 days a week. A couple of other new clinics coming our way soon. By the autumn of this year, we will have a travel clinic, which will allow people to get their vaccinations to travel aboard on site here, as opposed to having to go into one of the clinics in Edinburgh. We have given a few rooms to community treatment and care services. CTAC is a service that would predominantly have been provided out of a GP surgery, but now it's provided by the partnership, and it's things like wound dressings, ear irrigation, that sort of stuff. And finally, we've got 2 clinic rooms which we've upgraded their air changes to allow us to do minor ops on site here. Our endoscopy and day service unit continues to expand. From the old Rudlands Hospital site where we had 17 sessions, we have the capacity to go up to 30. Currently we're at 24, so we've increased our throughput by 41% to date. Gastroenterology tends to be our biggest service, but there are others. There are urology and there are gynecology. Also within the unit we have an IV therapy unit, and that's a collaboration between ourselves and the Edinburgh Cancer Centre Haematology unit. What this allows for is patients to come here to get their blood transfusions, their iron transfusions, rather than having to go up to the Western General Hospital in Edinburgh. It has been a real success story, both in collaborative work between us and the Western General and patient feedback on how much they prefer being able to come to a local site rather than having to go to the Western General.
We also receive cards from patients who have been for procedures, kind of thanking us for what we have done and even thanking the hospital.
We have a discharge lounge within the department and it has a whiteboard on it, and the patients are invited to put comments, you know, negative, positive, whatever. We love all feedback, but I have to say they're all positive and they're quite complimentary, to say the least.
As part of our endoscopy unit, we also have a teaching facility with a seminar room where we can view what's happening in either of our 2 procedure rooms. And that can also be transmitted out with this building to other sites, be that Fife, Borders, further afield. And that's a real boom to have that on site. We're getting to a stage where we're going for something called JAG accreditation, JAG meaning the Joint Advisory Group, and it's part of the Royal College of Physicians. And should we be accredited, we'd be one of the first organisations in Scotland to be so awarded. And that would be a bit of a feather in our cap. And we're actually in the process of applying for that as we speak at the moment.